Hi, my name is Taishi Hirai. I'm one of the Interventional Cardiology Fellows at University of Chicago. Today I have a privilege of interviewing Dr. John Lopez, who is the Chief of Interventional Cardiology Research at Loyola University Medical Center. He has been my mentor over the past 6 years of training for me at Loyola University, and I'm very honored to interview him today. How are you doing, Dr. Lopez?
Great, thank you, Taishi. Thank you for having me.
How has your ACC 2008 going so far?
It's been fantastic. A little bit overwhelming, but fantastic.
Was there any particular topic or talk that interested you during this conference today?
Well, I think there's any number of topics of interest. I am, for one, fascinated by the progress in the TAVR space specifically, and I think there are a number of sessions that sort of outline the changes, the streamlining, the efficiency of that procedure, which I think is just remarkable.
Mm-hmm. So you told me about the TAVR, but any other particular device maybe in the coronary space that kind of interested you during this ACC so far?
Well, I think that I've spent some time in the imaging sections, and I think both the OCT and IVUS work is of interest. I sat in on a session on the use of those technologies for CTOs today, which was another area that I've not been exposed to before. And I think that regardless of your particular interest or level of expertise, one of the fascinating things about this meeting is the ability to be involved and to learn about topics that you don't have particular experience in. Right. And even for somebody who's been doing this for 25 years, I just love the opportunity to sit in on a session of something that I am not familiar with, and to hear an expert speak and to spend 3 hours and learn way more about a topic than you ever knew before.
So I'm finishing up interventional fellowship, and there are cardiology fellows probably watching who wants to go into interventional fellow. Do you have any particular advice to those folks?
Yeah, I think my advice is the same ones I've given you and any sort of other residents or fellows I work with, which is to really be a student of the game, to learn the literature, to read the literature, to spend a lot of time reading and reviewing things. One of the fascinating things about this meeting is the availability on the ACC app to review the slides of even talks that you have not been able to go to online, which I think is just a marvelous advance, right? So, if you're like me, you may have 3 or 4 different sessions that you want to be to at any particular time, right? So you make a schedule and you have 4 things that you'd like to be to that at exactly the same moment, and if you have the abilities to go back later on and go through the slides, find the references and save them for your future efforts, I think that's a great way to expand your learning beyond the time that you're here.
I think you're giving some talks during this ACC session. What are you going to talk about maybe tomorrow?
I have one talk which is really talking about complex revascularization and specifically the use of rotational atherectomy in our current age and era.
I see. If you want to see similar presentation like this, please go to youtube.com/FITsontheGO. Thank you.